If your doctor looked at your chart during your last appointment, smiled, and said, "Your heart rate looks completely normal," I want you to stay with me for the next few minutes before you assume there's nothing else to think about. Because after more than 3 decades of caring for older adults with heart disease, I've learned that one of the biggest mistakes we make is believing a single number can tell the whole story about your heart. In fact, some of the sickest patients I've treated had heart rates that looked perfectly normal on paper. And some of the healthiest people I've ever met had heart rates that would have worried anyone who didn't understand the bigger picture. So here's the question I want you to think about today. What if the number you've been told is normal isn't actually the right number for you? By the end of this video, you'll understand why 2 people who are both 72 years old can have exactly the same resting heart rate, yet one is enjoying an active, independent life, while the other is unknowingly moving toward a serious heart problem. You'll also learn the one simple test you can perform at home that can reveal more about your cardiovascular health than many people realize. Before we go any further, I'd like you to participate in today's discussion. Leave a comment with your age and, if you know it, your resting heart rate. Just write something like 69, 64 beats per minute. And if you've ever noticed your heart suddenly racing, skipping beats, or feeling unusually slow, add the word heartbeat to your comment. Later in this video, you'll understand exactly why I'm asking. Now let me tell you about Robert. Robert was 76 years old when he first walked into my office. He wasn't there because of chest pain. He wasn't there because he'd suffered a heart attack. He wasn't even there because he thought something was wrong with his heart. His daughter had insisted he schedule an appointment after noticing he had become unusually tired over the previous 6 months. Robert laughed as he sat down. "My daughter worries too much," he told me. "I guess getting old just catches up with everyone." At first glance, nothing seemed particularly alarming. His blood pressure was acceptable. His cholesterol was reasonably controlled. His blood tests were reassuring. Then we checked his pulse. 52 beats per minute. Robert smiled. "I've always heard that's a good thing," he said. "My neighbor says athletes have slow heart rates." Technically, he wasn't wrong. Many highly trained athletes naturally have resting heart rates in the 40s or 50s because their hearts have become remarkably efficient through years of conditioning. But Robert wasn't a lifelong runner. He wasn't cycling 50 miles every weekend. He wasn't swimming laps every morning. In fact, he admitted he hadn't exercised consistently for nearly 15 years. That's when I realized something important. We weren't looking at an athlete's heart. We were looking at an older heart that might be sending us a warning. Instead of assuming everything was fine, we decided to investigate further. Additional testing showed that Robert's heart wasn't beating slowly because it was exceptionally healthy. It was beating slowly because its natural electrical system had begun to wear down. The tiny electrical signals responsible for keeping every heartbeat perfectly timed were becoming unreliable. Some impulses never reached the lower chambers of his heart. Others arrived late. His heart wasn't conserving energy. It was struggling to maintain rhythm. A few weeks later, Robert received treatment that dramatically improved his symptoms. Several months afterward, his daughter came with him to a follow-up appointment. She smiled and said something I'll never forget. "I thought Dad was slowing down because he was getting older." It turns out his heart was slowing him down. That sentence perfectly captures why I'm making today's video. Because one of the greatest misconceptions about aging is believing every new symptom is simply part of getting older. Sometimes it is, but sometimes your body is quietly asking for help, and your heart often starts speaking long before it starts screaming. The problem is that most people don't recognize the language. We've all heard the same advice. A normal resting heart rate is somewhere between 60 and 100 beats per minute. It's printed in health magazines. It's repeated online. Many people hear it from friends and family. Even healthcare professionals often use it as a quick reference. But here's what almost nobody explains. That range was never intended to mean every number inside it is equally healthy for every person. Nor does it mean every number outside that range is automatically dangerous. Age matters, fitness matters, medications matter, medical history matters, hydration matters, stress matters, sleep matters, even the time of day matters. Your heart rate is not simply a number, it's information. And like any information, it only becomes meaningful when interpreted in the right context. Imagine someone tells you the outside temperature is 70 degrees. Is that hot? Is it cold? The answer depends on whether you're standing in Florida during summer or walking through the mountains in early spring. The same number means different things depending on the situation. Heart rate works exactly the same way. Two people can have identical readings while their hearts are telling completely different stories. That's why I want you to stop chasing the idea of a perfect number. Instead, I want you to understand what your own heart is trying to communicate. Over the last 30 years, I've had conversations with thousands of older adults. Some worried because their smartwatch showed a resting heart rate of 58. Others panicked after seeing 78. Still others ignored persistent readings over 90 because they had been told anything under 100 was normal. The truth was different for every single one of them. One woman in her 70s had a resting heart rate of 55. Her heart was perfectly healthy. She walked 3 miles every morning, practiced yoga 4 days a week, maintained an ideal weight, and had no symptoms whatsoever. Her slow pulse reflected an efficient cardiovascular system. Another patient of almost exactly the same age also had a resting heart rate of 55, but he became dizzy every time he stood up. He often felt exhausted by lunchtime. Occasionally, he experienced brief episodes where everything around him seemed to fade for just a second or two. Same number, completely different meaning. One heart was healthy, the other needed medical attention. That's why numbers never replace understanding, and understanding is exactly what I hope you'll gain before this video ends. Now here's something that surprised even many physicians when larger population studies began examining resting heart rate over long periods of time. Researchers noticed that people with persistently higher resting heart rates often experienced more cardiovascular problems over the years than those with lower but appropriate heart rates. Notice the word I used, appropriate, not simply lower, because extremely low heart rates can also become dangerous depending on the individual. The healthiest heart isn't always the slowest. It isn't always the fastest. It's the one that supplies your body with exactly what it needs without placing unnecessary strain on the cardiovascular system. That's a much more complicated conversation than simply saying 60 to 100 is normal. And that's the conversation we're going to have today. In the next section, I'm going to explain something most people are never told after they turn 65. Your heart at 75 is not simply an older version of your heart at 45. It actually functions differently in several important ways. The muscle changes, the electrical system changes, your response to exercise changes. Even the medications you've taken safely for years can begin affecting your heartbeat differently. Once you understand those changes, you'll never look at your resting heart rate the same way again. Now, before we talk about what your heart rate should actually be, you need to understand something that changes almost every older adult's cardiovascular system, whether they realize it or not. Your heart doesn't simply get older, it adapts. And sometimes those adaptations protect you. Other times, they quietly increase your risk. Think about your favorite rubber band. When it's brand new, it stretches easily and snaps back into place without much effort. But leave that same rubber band sitting in a drawer for 20 years, and something changes. It becomes stiffer, less flexible, less responsive. A similar process happens throughout your cardiovascular system as you age. Your arteries gradually become less elastic. Your heart muscle becomes slightly thicker. The electrical pathways that coordinate each heartbeat may slow down. The nervous system that automatically adjusts your heart rate doesn't respond as quickly as it once did. None of these changes happen overnight. They happen so gradually that most people never notice them. Until one day, they do. Perhaps it's climbing a flight of stairs that suddenly feels harder. Maybe it's becoming unusually tired after grocery shopping. Perhaps you notice your heart pounding after a simple walk that never used to bother you. Many people assume that's simply because they're getting older. Sometimes that's true, but sometimes those symptoms are your heart asking for attention. One of the biggest misconceptions I hear from patients is this: my heart rate has always been around 75, so I know everything is fine. I always respond with the same question. Has everything else about your body stayed exactly the same over the last 20 years? Of course not. Body weight changes, muscle mass changes, medication changes, sleep changes, stress changes, kidney function changes, hormone levels change. So why would we expect your heart to behave exactly the same at 75 as it did at 50? We shouldn't. This is where research has become incredibly valuable. Large population studies following tens of thousands of adults over many years have consistently shown that resting heart rate is closely linked to overall cardiovascular health. Individuals with persistently elevated resting heart rates often experience higher rates of cardiovascular events and mortality compared with those whose resting heart rates remain lower within an appropriate range for their health status. But here's the important part. That does not mean everyone should try to force their heart rate lower. That's where many people make a dangerous mistake. I've seen patients become excited after reading online that athletes often have resting heart rates in the 40s. Suddenly they think, if 50 is good, 45 must be even better. That's not how physiology works. A marathon runner who has trained consistently for 30 years develops a stronger, more efficient heart that pumps a larger amount of blood with every beat. Because each heartbeat delivers more blood, the heart simply doesn't need to beat as often while resting. That's called a high stroke volume. It's a sign of cardiovascular conditioning. But suppose another person has a resting heart rate of 45 because the heart's electrical system is beginning to fail. Those two numbers look identical on paper, yet one represents exceptional fitness. The other may require urgent medical evaluation. Again, the number is never the whole story. The story behind the number matters. Let me tell you about Helen. Helen was 73 years old. She loved spending time with her grandchildren. She attended church every Sunday. She walked her neighborhood almost every evening. One afternoon, she purchased a smartwatch. For the first few weeks, she checked it constantly. One morning, she noticed something that frightened her. Her resting heart rate was 92. She searched the internet. Within minutes, she convinced herself she was developing heart failure. By the time she came to see me, she was terrified. But after asking just a few questions, the picture became much clearer. Helen had recently recovered from a respiratory infection. She hadn't been drinking enough water. She was sleeping only 4 or 5 hours each night because she was caring for her husband after surgery. Her body wasn't failing, it was responding to stress. 2 weeks after improving her hydration, recovering from her illness, and getting adequate rest, her resting heart rate returned to the low 70s. Nothing was wrong with her heart. Her heart had simply been responding appropriately to what the rest of her body was experiencing. This is why context changes everything. Now let's talk about something that surprises many older adults. Your medications may influence your heart rate just as much as your heart itself. Beta blockers, commonly prescribed after heart attacks or for certain rhythm disorders and high blood pressure, intentionally slow the heart. Some calcium channel blockers can do the same. Certain medications for irregular heart rhythms are specifically designed to reduce how quickly electrical signals travel through the heart. In these situations, a lower heart rate may actually be expected. On the other hand, medications such as some inhalers used for asthma or chronic lung disease, certain thyroid medications, decongestants, and even excessive caffeine can increase heart rate. That's why I never evaluate a pulse without reviewing the medication list, because sometimes we're not seeing the heart's natural rhythm, we're seeing the effect of treatment. There's another change that deserves attention after age 65. Your body's automatic response system becomes slower. When you were 30 years old, standing up from a chair caused your nervous system to adjust almost instantly. Blood pressure changed, heart rate increased slightly, blood flow to the brain remained stable. Most people never noticed anything happening, but after 70, those adjustments often become slower. Your heart may take a little longer to respond. Your blood vessels may react more gradually. If you're dehydrated or taking several blood pressure medications, that delay can become even more noticeable. That's why some older adults feel lightheaded for a few seconds after standing. It isn't always dangerous, but it should never be ignored if it happens repeatedly, because repeated dizziness isn't simply inconvenient. Falls remain one of the leading causes of serious injury among older adults, and sometimes the heart plays an important role in that story. Here's something I'd like you to think about tonight. Don't just ask yourself, what is my heart rate? Instead ask, has my heart rate changed recently? Do I feel different than I did 6 months ago? Am I more tired? Do I become short of breath doing activities that used to feel easy? Have I noticed skipped beats, fluttering, or episodes where my heart suddenly races? Those questions often reveal far more than a single number ever can. In the next part of this video, we're going to answer the question everyone asks me in the clinic. What resting heart rate is actually best after age 65? The answer isn't one number. In fact, depending on your age, your medications, your activity level, and your medical history, the healthiest heart rate for one person may be completely inappropriate for another. And once you understand that framework, you'll stop comparing your heart to everyone else's and start understanding what is truly right for you. Now we come to the question almost every older adult asks me. Doctor, just tell me the number. I don't want all the science. What should my resting heart rate actually be? I understand why people ask that. We like certainty. We like simple answers. But medicine doesn't always work that way. If I told every person over the age of 65 that the ideal resting heart rate is exactly 65 beats per minute, I would be giving bad advice. Not because 65 is a bad number, but because I wouldn't be treating the person, I'd be treating the chart, and those are two very different things. Let me introduce you to two patients. James was 68 years old. He walked 4 miles almost every morning. He had maintained a healthy weight for decades. He never smoked. His blood sugar was normal. His blood pressure was well controlled. His resting heart rate averaged 58 beats per minute. He had no dizziness, no shortness of breath, no fatigue, no fainting. For James, that heart rate reflected excellent cardiovascular conditioning. Now meet Richard. Richard was also 68. His resting heart rate was almost identical, 59 beats per minute. On paper, they looked nearly the same. But Richard became exhausted climbing one flight of stairs. He occasionally felt as though he might pass out. His wife noticed he sometimes became confused for a few seconds while standing. Further evaluation showed that his heart's electrical conduction system had begun to fail. Same age, almost identical heart rate, completely different diagnosis. This is why context always comes first. Over the years, I've developed a simple framework that helps many of my patients understand their heart rate without becoming obsessed with a single number. If you're between 65 and 74, physically active, have no major heart disease, no troubling symptoms, and your physician has evaluated you, a resting heart rate somewhere around 60 to 70 beats per minute is often completely appropriate. Some healthy adults may naturally sit slightly below that. Others may consistently remain in the low 70s. Both can be perfectly normal. If you're taking medications such as beta blockers or certain rhythm control medications, your expected resting heart rate may naturally be lower. That isn't automatically a problem. In fact, it may be exactly what your treatment is designed to achieve. However, if your resting heart rate falls into the 40s or low 50s and you experience dizziness, fainting, unusual fatigue, confusion, or reduced exercise tolerance, that deserves medical attention. Those symptoms matter far more than the number itself. Now let's talk about another group. Many adults between 75 and 85 begin taking several medications for blood pressure, diabetes, cholesterol, arthritis, or heart disease. Each medication may influence the cardiovascular system differently. Sometimes the combined effect produces a heart rate that appears acceptable during a clinic visit, but behaves very differently throughout the rest of the day. I've had patients whose heart rates looked perfectly stable while sitting in my office. Then they wore a heart monitor for 48 hours. The results told an entirely different story. Their heart rate dropped dramatically during sleep. Others experienced brief episodes where the heart suddenly accelerated to well over 130 beats per minute before returning to normal. Those episodes lasted only a few seconds. Without monitoring, neither the patient nor the physician would ever have known they occurred. That's why symptoms are so important. Your body often notices a problem before medical equipment does. Let me tell you about Margaret. Margaret was 79 years old. She enjoyed cooking for her family every Sunday. One afternoon, she noticed something strange. Every time she carried groceries into the house, she felt her heart fluttering. The sensation lasted less than a minute, then everything returned to normal. She ignored it for nearly 8 months. It only happens once in a while, she told herself. Eventually, her daughter convinced her to seek evaluation. A portable heart monitor revealed intermittent episodes of atrial fibrillation, one of the most common heart rhythm disorders in older adults. Because the condition was identified early, treatment significantly reduced her risk of complications, including stroke. Margaret later told me something that stayed with me. I thought my heart was just reminding me I was getting older. It was actually asking me for help. That's an important distinction. Aging itself doesn't automatically cause dangerous heart rhythms, but age increases the likelihood that conditions affecting the heart's electrical system may develop. The sooner they're recognized, the better the opportunity to manage them. Now let's discuss something I recommend to nearly every older patient. Don't rely on a single reading. Instead, build a trend. Here's how. Measure your resting heart rate at approximately the same time each morning before coffee, before exercise, and before beginning your daily activities. Sit quietly for 5 minutes. Relax. Then measure your pulse for a full 60 seconds or use a reliable heart rate monitor. Record the number. Repeat this every morning for 2 weeks. You're not looking for perfection. You're looking for consistency. If your normal resting heart rate has always been around 65 and suddenly remains in the mid-80s for several days without an obvious explanation, such as illness, dehydration, or emotional stress, that's worth discussing with your healthcare professional. Likewise, if your heart rate suddenly becomes much slower than usual and you begin feeling weak, dizzy, unusually tired, or short of breath, don't simply assume it's because you're getting older. Patterns often tell us more than isolated measurements ever can. This is also why I encourage patients to pay attention to how they feel rather than becoming obsessed with smartwatch notifications. Technology is incredibly useful. I recommend it often. But technology should inform you. It should not frighten you. A smartwatch cannot interpret your medical history. It doesn't know which medications you're taking. It doesn't know whether you've been dehydrated, fighting an infection, or sleeping only 4 hours each night. Only the complete clinical picture can answer those questions. In the next and final part of this video, I'm going to show you a simple framework I use with many older adults to decide when a heart rate is reassuring, when it deserves closer monitoring, and when it requires immediate medical attention. I'll also explain several warning signs that should never be ignored, even if your heart rate appears perfectly normal on the screen in front of you. Because sometimes the most dangerous heart problems don't begin with an abnormal number. They begin with symptoms that people dismiss as just getting older. And that's exactly what I want to help you avoid. Now let's bring everything together. After 32 years of caring for older adults, I've learned that the healthiest patients don't obsess over a single number. They learn to recognize patterns. They understand their own bodies. And most importantly, they know when something has changed. That's exactly the framework I want to leave you with today. The first step is knowing your normal. Not your neighbor's normal, not the number you read online, not the number someone mentioned on television. Your normal. If your resting heart rate has been between 62 and 68 for years, and you feel energetic, remain physically active, and your physician has found no underlying heart condition, that pattern is reassuring. But if that same heart suddenly begins resting in the 80s without an obvious reason, or drops into the 40s while you feel weak or dizzy, that change deserves attention. Remember, your heart doesn't suddenly change its behavior without a reason. Sometimes the explanation is simple: a viral illness, dehydration, poor sleep, a new medication, too much caffeine, an overactive thyroid. But occasionally, the change is your body's first warning that something more serious is developing. That's why I tell my patients to become students of their own health, not anxious, not fearful, simply observant. Here's something you can begin doing tonight. It takes less than 5 minutes. Sit quietly in a comfortable chair. Rest for at least 5 minutes without talking, watching television, or using your phone. Measure your resting heart rate. Write it down. Now ask yourself 4 simple questions. Has this number changed noticeably over the past few weeks? Have I been feeling more tired than usual? Do I become short of breath doing activities that were easy a few months ago? Have I experienced dizziness, fainting, skipped beats, or episodes where my heart suddenly races? Those 4 questions often tell me more than the number itself. If the answer to all of them is no, that's reassuring. If one or more of them is yes, it's time for a conversation with your healthcare professional. Not because something terrible has happened, but because your heart deserves to be understood before small problems become larger ones. There are also situations where I don't recommend waiting. If you develop severe chest pain, fainting, sudden shortness of breath, persistent palpitations, or symptoms that are intense or rapidly worsening, seek urgent medical care immediately. Those symptoms should never be ignored, regardless of what your smartwatch says. One of the biggest mistakes I see is people placing more trust in a device than in the symptoms their own body is giving them. Technology is helpful, but your body is still your best messenger. Your smartwatch can count your heartbeat. It cannot explain why your heartbeat has changed. That's where proper medical evaluation becomes important. Before we finish, let me tell you about one final patient. Her name was Eleanor. She was 81 years old, independent, sharp, still reading 2 books every week, still volunteering at her local community center. She came to see me carrying a notebook. Inside were 6 months of handwritten heart rate readings. Every morning, every evening, she had carefully documented each measurement. What caught her attention wasn't a single number, it was a gradual trend. Her resting heart rate had slowly increased from the low 60s into the upper 70s over several months. She didn't have chest pain, she didn't faint, but she noticed she needed to stop and rest while walking up the hill near her home. Because she paid attention early, we were able to identify an underlying condition before it caused a medical emergency. Months later, she returned for another appointment. She smiled, held up the same notebook, and said something that has stayed with me ever since. I stopped chasing perfect numbers. I started paying attention to my heart. That's exactly what I hope you'll do after watching this video. Don't chase perfection, chase understanding. Because your heart is far more intelligent than most people realize. It constantly adapts to your activity, your emotions, your sleep, your hydration, your medications, and your overall health. A single number can never tell that entire story. Only the complete picture can. So what have we learned today? You've learned that there is no one perfect resting heart rate for every older adult. You've learned that age, fitness level, medications, chronic medical conditions, and symptoms all influence what is appropriate for you. You've learned that the trend over time is often more valuable than one isolated reading. You've learned that symptoms such as dizziness, fainting, unexplained fatigue, shortness of breath, or persistent palpitations should never be dismissed as simply getting older. And you've learned that understanding your own normal is one of the most powerful tools you have for protecting your heart. If this video has helped you see your heart rate differently than you ever have before, I'd like to ask one small favor. Please subscribe to this channel. Every new subscriber helps this information reach more older adults and their families. People who may never have been told that heart health is about much more than a single number. If you found today's discussion valuable, give this video a like and share it with someone over the age of 65. It may encourage a conversation that changes or even saves a life. Remember this, your heart isn't trying to confuse you, it's trying to communicate with you. The question is whether you're listening. Know you're normal, pay attention to changes, ask questions, and work with your healthcare professional to understand what your heart is telling you. Because the healthiest heart isn't the one with the most impressive number. It's the one that keeps you living the life you love, safely, confidently, and for many years to come. Before we finish, there's one more conversation we need to have because it answers many of the questions I receive from older adults every single week. Doctor, what about exercise? My heart rate goes up when I walk. It sometimes drops into the 50s while I'm sleeping. My smartwatch keeps sending me alerts. Should I be worried? Let's start with exercise. One of the biggest mistakes I see is people becoming afraid every time their heart rate increases during physical activity. Remember, your heart is designed to respond to movement. When you begin walking, climbing stairs, gardening, or carrying groceries, your muscles suddenly require more oxygen. The only way to deliver that oxygen is for your heart to pump more blood. That means your heart rate should increase. In fact, if your heart rate never rises appropriately during activity, that can sometimes be just as concerning as a heart rate that rises excessively. I've had patients tell me, I stopped walking because my heart rate reached 90. My first question is always the same. How did you feel? Were you comfortable? Could you carry on a conversation? Did the heart rate return toward your usual level after you rested? If the answer is yes, that response is often completely appropriate. The goal isn't to keep your heart rate low every minute of the day. The goal is for your heart to respond normally to what your body is asking it to do. Now, let's talk about sleep. Many people become frightened after looking at their smartwatch in the morning and seeing that their heart rate dropped into the low 50s or even the upper 40s while they were asleep. For many healthy adults, that's perfectly normal. During deep sleep, your body's demand for oxygen decreases. Your nervous system shifts into a more relaxed state. As a result, your heart naturally slows down. That's part of normal physiology. The important question isn't whether your heart rate slows during sleep. The important question is whether you're experiencing symptoms when you're awake. Do you wake feeling refreshed? Or do you wake exhausted, dizzy, or short of breath? Those details matter far more than one overnight reading. Now let's discuss smartwatches. I believe wearable technology has helped many people become more aware of their health. In some cases, smartwatches have even alerted people to irregular heart rhythms that were later confirmed by medical testing. That's a tremendous benefit. But smartwatches also have limitations. A loose band, cold weather, movement, poor skin contact, or even certain arm positions can produce inaccurate readings. I've seen patients rush into the emergency department because their watch briefly displayed a heart rate of 180. When we evaluated them, their actual heart rate was 72. The watch wasn't lying. It was simply measuring imperfectly under difficult conditions. That's why I always tell patients, treat your smartwatch as a helpful assistant, not as your doctor. If your watch repeatedly detects unusual readings, especially when they're accompanied by symptoms, take that information seriously and discuss it with your healthcare professional. But don't allow one unexpected notification to convince you that something terrible has happened. Now I'd like to leave you with one final patient story. Her name was Linda. Linda was 77 years old. Every morning, she walked with 3 close friends around a nearby park. One morning, she noticed she couldn't keep up with the group. Not because she was out of breath, not because of chest pain. She simply felt unusually tired. She assumed she hadn't slept well. Over the following weeks, the same thing happened again and again. She slowed down. She rested more often. Her smartwatch showed heart rates that seemed perfectly normal, so she ignored the symptoms. Fortunately, one of her friends encouraged her to schedule an appointment. Further evaluation showed that Linda had developed an abnormal heart rhythm that wasn't present all the time. It came and went. That explained why routine office visits had never detected it. After appropriate treatment, Linda gradually returned to her morning walks. Several months later, she smiled and told me something I'll never forget. I spent months trusting the numbers. I should have trusted how I felt. That sentence captures the entire message of today's video. Numbers matter. Research matters. Technology matters.